Hi, everyone, and welcome to Healthwatch. I'm your host, Carolyn Wilson from Ledge Light Health District. The goal of this program is to bring you information on a wide range of important health topics and to introduce you to the people who are doing great work across the community. Today, I'm joined by Marcia Beebe from Sound Community Services to discuss behavioral health homes. Marcia, thank you so much for joining me today.
Thank you for having me.
So, you and I have not met. We are new to each other.
Most certainly.
Yes, and so we have a lot to talk about today, but at first, I want to spend just a little bit of time getting to know you first.
Okay.
So tell me and our viewers how long you've been involved in behavioral health and how long you've been with Sound Community Services.
Well, I've been involved with behavioral health a couple times in my career. I've had an eclectic resume that has involved hospital nursing, home healthcare, hospice, and behavioral health. I was a nurse manager, a charge nurse, and then a nurse manager at Stonington Institute for many years, and was involved with their dual diagnosis program, their adolescent psychiatric program. So I've had some background in that, but then moved into long-term care and rehab in that sense. Most recently, last summer, this opportunity presented itself to come join the team here at Sound. And I have to say that it was a reopening of a new experience for me, but it felt very much like coming home.
That's great. So for those of you who may not be familiar with Sound Community Services, Marcia, will you describe it a little bit for our viewers?
I certainly will. We're a nonprofit agency that seeks, if you read our website, to educate, assist, and support individuals that have mental illness and or substance abuse disorders.
Wow, that's really important work.
We have a variety of programs. It involves individual therapy. It involves a med management clinic. It involves homeless support, residential care. So it's a broad spectrum of services that we offer here.
That's terrific. As you were saying, Sound Community Services offers a lot to its clients. What's your direct role in the agency?
My service program is called BHH, Behavioral Health Home. And what has happened is on a state level, it was decided that this would be an additional layer of services that can be provided to individuals who are most at risk, integrating both their mental health needs and their medical needs. So that's really what our program does. Everybody thinks it's about housing, but it's not. It's about creating a support system and a case management system to assist individuals live a healthier, longer life.
Right, and that's so important. It sounds like there's a lot of wraparound services. And of course, housing is important and part of public health for sure. Explain in a little bit more detail behavioral health homes within a wellness lens. That's always my point of view when I come to public health as a health educator. Wellness. How do behavioral health homes do that?
Well, basically, our most important role is to support medical care. Our clients, oftentimes, medical care means the emergency room or emergency hospital admission. We want to establish ongoing relationships with providers in the community, doctors, dentists, in a preventative care way preventative care is not normally part of many of our clients' life. Self-care is not part of their vocabulary. Basic survival is part of their life. So we have to assist them in many ways to connect to community providers and then to keep those appointments. It's not just getting a community provider, it's keeping appointments, and it's overcoming all those barriers, whether they be transportation, whether it be walking into a waiting room with an anxiety disorder and how disheartening that must be. Filling out those questionnaires they give you on the clipboard with that funny pen. These are all barriers for our clients. So in BHH case management, our job is to seek to connect them, to support them. Sometimes that may be bus tickets. Sometimes that may be arranging VEO transportation. Sometimes that may be actually going with them to the doctor's appointment to be an advocate and to make sure their questions are answered. We also do things like rehearse with them the questions that they might want to ask the doctor and provide a little cue card for them. And then we do follow-up, making sure they get labs that are ordered, making sure that they go back for the follow-up appointment when it's scheduled. And then to start to move towards wellness with small changes in their behaviors, less soda maybe if they're diabetic. What are some healthier food choices you can make at the convenience store, or down the block at the CVS? These are all things that the case managers help them with every single day, in addition to hooking them up, making internal referrals to therapy, or making sure that they get connected to our housing programs.
Wow, there's so much that that your agency helps people with, and I'm lucky to say that I'm familiar with some of it. I have a relationship with Sound going back to about 2012. And as I often bring up on the show, I'm a health educator by trade. And one of the first grants that I ever got to write was one to work with Sound Community Service on wellness programming. Yes.
So our background.
I do. And I have to say, I was so excited when I heard the news that we got that grant. And I had the privilege of going to what was then an off-site peer-based clubhouse, which is now on-site. Mm-hmm. And we would do all sorts of wellness programming. And I got to do a little bit of tobacco cessation as well. And it really was my first foray into, actually running a health promotion program by myself. It was one of my first big things that I got to do when I got here. And I remember, developing great relationships, and that people were very interested in finding ways to improve their wellness. And it was just a wonderful time, and I'll never forget it. So as you're telling me about all these important things you do,
sounds familiar.
It does sound familiar, and it's certainly very important, to the clients too, because they certainly appreciate it.
And one of the most important things is that personal relationship with the case manager. It's not scripted, it's not scheduled, but frequent outreaches to the individual clients, assessing their needs, putting together a recovery plan with them that includes wellness goals, and then breaking down those goals into very tiny steps, because sometimes it's just walking to the mailbox once a day. That is the first step towards more exercise or being well or getting out of bed more often and moving around, and having something that they can accomplish in a small way leads to bigger goals.
Right. Small steps for so many of us. That's the only way to get to where we're going.
Exactly.
Right. So tell us a little bit more about the clients that you serve.
Our clients basically are those that have Medicaid as their insurance, as their payer source, And their past history has demonstrated that they are utilizing the ER at the hospital more than generally is what most people do. And so the whole goal here is to keep them out of the ER, keep them out of emergency hospital admissions, and keep them out of skilled nursing facilities. We really want them to have a healthier, longer life, because data shows us that these people with undertreated illness, physical illness, as well as mental health issues, tend to die much sooner than the general population. So our job is to prevent the high utilization of medical services that aren't preventative and aren't helping them. It's just really putting a Band-Aid on something. We're trying to change their lifestyle in terms of their medical lifestyle and what they're going to utilize and what's provided to them. And we're looking to give them a healthier lifestyle overall.
Right. I can't say it enough, what an important service that is. So, Marcia, we're going to take a quick break. I hope just stay put, and to our viewers, we'll be back in a few minutes. Hope you'll join us back.
All right. Thanks.
Today I'm going to talk to you about physics. Come on in, girls. Let's go. This is the first rocket to get humans to Mars. Really tall. I'm a rocket structural engineer, designing and building parts of the rocket. You are the generation that will be stepping foot on Mars. Do I have a group of astronauts on my hands? Yes. You can become a rocket scientist or whatever else you want to be.
Welcome back, everybody, to Healthwatch. I'm Carolyn Wilson, your host, and today I have the distinct privilege of having Marcia Beebe from Sound Community Services representing their behavioral health home program. So right before the break, we were talking about sound and a little bit of a client profile. And Marcia, as we jump back into our conversation, you were telling me, you were describing to me the types of clients that you serve. How many clients does Sound serve?
Well, in the BHH program, it is the one that I address more than anything else. I oversee 2 nurses in the clinic. I oversee a medical assistant. And then I have 3 case managers that are in the care coordination program. And each one of those case managers handles about 100 clients. Now, in addition to that, we have case managers in other programs that are providing this extra layer of service to their clients as well, to BHH eligible clients in their programs. So they deal with about 100 clients. So all told, our enrollment runs about 415 individuals that we serve in a multitude of ways. But as I said, the majority of them, about 300 or so, are specific in BHH care coordination, and those case managers do exactly what that says. They try to knit together a support system of providers that address the medical needs of their clients.
That's great. So when we talk about the large amount of people that you serve, in public health, we look at health in a community lens, a population level lens. And we often talk about things like health outcomes. And I know in medicine, basically that's how they measure their progress too, is with health outcomes. What are the sorts of things that we can do to help clients and the population as a whole, really, to improve those health outcomes?
Well, basically, we look at the areas that most of us know to be the most problematic. We look at hypertension. We look at hyperlipidemia, high cholesterol. We look at obesity. And we look at respiratory illnesses like COPD and asthma. These are things that people chronically struggle with in the community and often are undertreated. So you don't go to the doctor unless you absolutely have to, and usually you end up in the emergency room or an emergency hospital stay. And that's what we want to prevent. We want to stay on top of it, but help the individual manage their health issues in a more positive way so that they don't end up sitting in an ER for 8 hours.
Absolutely, and I think we can extend that charge to the rest of the community as well, for sure. Preventive care is just so important.
Exactly.
Yeah, I remember once again before the break we were talking a little bit about wellness programming and how important it is to take care of yourself. And for some people, it's a little bit harder to take care of yourself than others. And certainly having an opportunity to promote wellness with especially high-risk clients is even more rewarding because they really do appreciate it.
Education is a big part of that. Our case managers always seek to provide information, the latest and greatest. They're internet searchers, and they try to equip their clients with the information that they can use and understand. So that's one of the things that they do. But when we're doing face-to-face before the present pandemic, they would conduct monthly group offerings on different health subjects, and always trying to do it in a fun but very absorbable way.
Yeah, that's so important. As a health educator, I can tell you, if they're not listening to you, they're not getting the information, that's for sure.
And it always helps to have snacks.
Yes, absolutely. So let's talk a little bit about health behavior change, which is, as my loyal viewers know, it's one of my favorite things to talk about. Leading people to lead a healthier life, guiding people towards better health. And I think it's important we talk about change talk. So how do you help people change?
Well, basically, the case managers use a motivational interviewing skills to move the individual or move that person's needle just slightly, and eliciting that change from the individual, not from someone handing you a program or handing you, a list of to-dos and don't-dos. So that we're really looking to bring that change about from inside the individual and then assist them in their little victories and those positive steps to wellness.
Right, that's so important. It can be overwhelming, if you take a look at all the things you want to change, and, it can be overwhelming for people for sure. So it sounds like there are a lot of good helpers.
There's a lot of barriers that, that present themselves, and not the least of which is the language of medical care. It's hard to speak the language just to make an appointment. It's hard to attend an appointment and understand the language and from the receptionist to the nurse to the doctor. So there's a lot of barriers that sometimes we don't foresee, but when you go to your next doctor's appointment, you think of the next barrier placed in front of that individual. You watch how many barriers that you experience and imagine how someone who doesn't have a long history with the medical community feels.
Right. So we've talked a little bit about this so far, but how would you summarize your program's mission?
Our mission is to basically establish good medical care in the community with providers, whether that be a dentist, a doctor, anything that will lead to a healthier lifestyle. It might be a group. There might be a wellness group that they can be a part of. It might be connecting them to a socialization group as well, because they don't get out or they don't have a support system, natural support system in place. So we have a lot of things to do along that way, but basically we want, as I said, to keep them out of the emergency room, out of the emergent hospitalization, and we want to keep them out of nursing homes, skilled nursing homes. We don't want people to end up there only because they didn't get the care they needed along the way. We don't want them to be an underserved or undertreated population.
Right. Right, that's so huge. So let's talk a little bit about the pandemic and how it's affected the mission and client services.
Well, it's been an interesting transition for all of us, but it was pretty intense and rapid, even at the very beginning. Sound as an agency recognized very clearly that this was going to be serious and probably longer lasting than a 2-month time frame. So everybody just jumped on the plan and we went to telehealth rapidly. Our case managers increased their outreach to our individuals that we served. Programs that were in person had to shut down, but we found creative ways to still maintain contact with those people. Activity packages, food supports, mailings, online groups and online resources, connecting people to the local food banks, doing whatever we could. The outreach increased dramatically, and we found it to be very rewarding. We've been able to operate and serve the community even in the midst of having to do it totally different.
Right. Yeah, talk about a curveball for client care.
Yes.
So let's talk a little bit about the big thing that we saw with this, and I'm sure it affected your clients as much, if not worse, as everybody else. Isolation. We know that the more strict social distancing and the stay-at-home orders, we know across the board, we've been hearing about higher reports of depression and anxiety, and higher substance use levels as well. Do you think society as a whole learned a lot about the importance of connection and socialization to mental health?
Dramatically so. I just think from a personal standpoint, some of us still work in the building and some of us work from home, and it feels very strange not to have your teammates close by. You can't run down the hall and ask a question, or you can't relate in that way. So in a similar way, our clients have experienced the same thing. And that's why that frequent touch, that personal relationship with their case manager, their working relationship with their case manager is so dramatically important, because what might have been 4 phone calls a month previously is now maybe 4 phone calls a week to check in, to see if there's any needs that we can assist with. Sometimes it's just to provide, for example, we sent mailings on an anxiety workbook that some of our clients felt helpful. So it's been a dramatic change for all of us, and recognizing that we are under the stress as individuals, our clients are under the stress as individuals, and then trying to meet their needs in the midst of that, and just provide anything extra that we can and connect with program to program. You know, we had a young man came in for an injection because we're still providing the injections with very safe protocol. And he mentioned how much he missed one of our in-house programs. So immediately I connected with the leader of that program, and they increased their outreach to him so that he could have his needs met. And he was much happier with that added contact.
Wow, that's really great service. Yeah, that's a tough one for sure. How to adapt to these times.
Exactly.
It's a tricky one.
And making medical issues, you know, they now are not only just experiencing those access issues, but now we're all experiencing those access issues where you don't go to your doctor's office. Some are open, some are not. Some are, you know, the dentist is not quite as accessible as it was. They're only taking emergency cases. So there's been a lot of stresses on the system for all of us, but especially it's another layer for these individuals.
Right. So as we look to the future, you know, as we're, you know, in difficult times right now, but hopefully things will ease up at some point. It sounds like there's so many great things going on. What else is on the horizon?
Well, I think one of the things that we've learned through this, it's a confusing time and a little bit scary, but it's also a time that's exciting with great opportunity. I mean, how do we redefine ourselves and the mission that we're on? How do we provide those services in unique and continuing ways despite what might be going on? And then how do we make ourselves more of a social presence? Because we live in the community as well. And not only are the medical issues challenging, but at the moment, social issues are challenging. So how do we make ourselves a more positive social force as well, as a safe place for our clients to come and receive medical and psychiatric help?
Wow, tall order there.
But lots of work.
Right. Right. Well, Marcia, I just want to say thank you so much for being my guest today on Healthwatch. It truly was a pleasure to hear from you about the important programs that are available to some of our most vulnerable residents. I certainly learned a lot.
Thank you.
And to our viewers, thank you so much for tuning in. And we hope we'll see you again soon, right back here on Healthwatch.